What if everything you thought you knew about chemotherapy was just wrong? For many, the word itself conjures images of extreme suffering and an absolute last resort. But what if I told you that modern chemotherapy is far more manageable, it's incredibly effective, and constantly evolving? I'm Dr. Chaplin, and as a scientist who designs cancer drugs, I've gained unique insight into how outdated fears prevent people from understanding this life-saving treatment. My goal is to bridge that gap and empower you with accurate information. Today, we're going to separate fact from fiction and debunk 6 common myths about chemotherapy. So stick around, because understanding the truth could change your entire perspective on cancer treatment. Hello everyone, and welcome back to Elevating Cancer Treatment. As an immunologist, I'm driven by a passion for creating innovative new drugs that can truly make a difference in human health and well-being. As we get started, a quick reminder: the information in this video is for educational purposes only. It should not be taken as medical advice. Always consult with your personal health care provider for guidance on your specific situation. Every cancer is different, even if it's the same type, even if it's a relative, it's your personal journey. Here on this channel, we explore the intricate world of cancer. We dissect the science and debunk common myths to help you navigate your health journey with clarity and hopefully confidence. What truly distinguishes my approach is this dual commitment. Beyond researching cancer, I'm deeply involved in crafting the innovative drugs and treatments that are defining the future of oncology. This direct, hands-on experience offers me an unparalleled grasp of these therapies' molecular mechanisms and their interaction with the human body. So that's a very unique insight, and I'm excited to share it with you. If that sounds like something that you're interested in, please make sure to like this video, subscribe to the channel, and hit that notification bell. That way, you'll never miss an update. Also, before we dive into today's myths, 2 quick things. First, as a thank you for being here, I've created a free resource, 10 Things to Know About Chemotherapy, which you can download from our link in the description. Second, by signing up for that, you'll not only get the guide, you'll also get exclusive updates on the innovative new treatment that I'm working on. I'm confident this represents a significant leap forward in immunotherapy for cancer, and I'm committed to bringing you direct updates on its advancements. Take a moment, download your free guide, and join us in shaping the future of cancer treatment. So today, we're shedding light on chemotherapy. For many people, the idea of chemotherapy can be very daunting. It's often surrounded by outdated misconceptions and fears. That's why we're here, to demystify this powerful treatment by debunking 6 common myths. Our goal is to provide you with clear, accurate information so you can better understand what chemotherapy is, what it truly entails, what to expect. Let's get started. So, what exactly is chemotherapy? At its core, chemotherapy, often simply called chemo, uses specialized drugs to destroy cancer cells and to stop their uncontrolled spread. You don't want them spreading throughout the body. Chemo kills them. But how does it achieve this? The fundamental principle behind chemotherapy lies in its ability to target rapidly dividing cells. It doesn't target cancer specifically, it targets rapidly dividing cells, and cancer cells are characterized by their rapid, uncontrolled growth. Since chemotherapies are designed to interfere with this process, it ultimately leads to the death of these cancerous cells. It's important to understand a key challenge in cancer treatment. Cancer cells are, at their root, just normal cells that have forgotten how to stop growing. This means that anything potent enough to kill a cancer cell is also likely to affect your healthy cells that divide rapidly, such as those in your hair follicles, those in your bone marrow, and the lining of the digestive tract. And this is why finding effective chemotherapy drugs is so challenging. The ideal cancer drug would be selectively toxic, meaning it would only harm cancer cells while leaving healthy cells completely untouched. While other approaches, known as targeted therapies, are highly specific to unique features of very particular cancers, they require an incredibly close match to be effective. Chemotherapy is different. It's broadly tuned to kill cells that grow rapidly and in an uncontrolled manner. Anything. So we will talk about targeted therapies in a future episode, definitely worth diving into. So these older chemotherapy treatments, particularly those from decades ago, they had a well-deserved reputation for harsh side effects. You'll see that in the movies all the time. But modern drug development has made incredible strides. Today, the focus is on developing smarter, easier, gentler drugs. This evolution means that the chemotherapy experience for patients today is often vastly different and much more manageable than it was in the past, and everything that you've seen in the movies. Forget that stuff. Let's delve into some key facts about chemotherapy that highlight its importance and its effectiveness in cancer treatment. Okay? First, chemotherapy targets fast-growing cells. We talked about that. As we mentioned, cancer cells are characterized by their rapid and uncontrolled division. Chemotherapy drugs are specifically designed to interfere with this rapid growth. That makes them highly effective against these aggressive cells. This mechanism is what makes chemotherapy a powerful weapon against many, many, many types of cancer. It doesn't have to be closely matched. Second, chemotherapy is often used as part of a combined approach to cancer treatment. It rarely stands alone. People don't usually just get chemo. Instead, it's frequently used in conjunction with other therapies. You might have surgery, you might have radiation therapy, you might have immunotherapy, but chemo is along with it, and this multi-pronged approach allows for a more comprehensive attack on the cancer, addressing different aspects of the disease, and really maximizing the chances of a successful treatment, of a cure. And that's really what you want. You want to cure the cancer. For example, chemotherapy might be used before surgery to shrink a tumor, making it easier to remove, or after surgery to eliminate any remaining cancer cells that have spread but can't be found. So finally, and perhaps most importantly, chemotherapy improves survival rates. Extensive research and clinical experience have consistently shown that chemotherapy significantly improves outcomes for various cancers. It plays a crucial role in extending lives and preventing recurrence. It is especially well suited to eliminating small metastases, which are tiny clusters of cancer cells that may have spread from the primary tumor but are too small to be detected. And if you can't find it by imaging scans, you can't cut them out or treat them with radiation. So by targeting these microscopic metastases, chemotherapy helps prevent the cancer from returning and spreading more widely in the future. This makes it an incredibly valuable tool in achieving long-term remission and improving the overall prognosis for cancer patients. So, myth number 1. Chemo is painful, and it always leads to constant severe nausea, fatigue, and diarrhea. This is perhaps one of the most persistent myths about chemotherapy. It's often stemming from outdated information or old media. The reality is that chemotherapy itself is not painful. The discomfort, if any, is usually related to the process of administering the IV or potential side effects that develop over time, not the drug itself. The drug flowing through your veins, it's not painful. It's true that 80 years ago, when chemotherapy drugs were first being widely used, there was a well-deserved reputation for severe nausea, severe debilitating fatigue, and persistent diarrhea, along with hair loss. However, our understanding of cancer and the drug choices that we have for treating it have advanced tremendously since then. Modern medical advances and sophisticated side effect management, we've got strategies that have revolutionized the chemotherapy experience. Pre-medications, for instance, are routinely given to help control nausea. It eliminates it before it can even begin. While side effects like nausea and fatigue can and do still occur, their severity and duration vary significantly from person to person, and they often last only a few days. The constant, severe symptoms that many people fear are far less common today, thanks to better therapies and improved supportive care. This means that while chemotherapy is still a serious treatment, it's often much more manageable than many people anticipate. Myth number 2. Chemotherapy requires long hospital stays. This is another common misconception that can add to the anxiety surrounding chemotherapy. This idea that being confined to a hospital for extended periods is necessary. That expectation is daunting, but for most patients, it's not the reality. Many chemotherapy treatments can be administered on an outpatient basis. That means you can go to a clinic or a hospital for infusion and then return home the very same day. Some treatments can even be given at home with a visiting nurse or a portable infusion pump. Furthermore, a significant and growing number of chemotherapy drugs are now available in pill form, oral form. This means you can take your treatment at home or even at work by yourself. Currently, about 1/3 of all chemotherapy drugs are given as pills, and nearly 50% of the new chemotherapy drugs that were approved between 2008 and 2020 were in this oral form. The shift toward oral chemotherapy offers much greater convenience and flexibility for patients, allowing them to maintain a much more normal routine during their treatment. That'll lead us to myth number 3. You can't work or maintain your normal life during chemotherapy. This myth is closely tied to the previous one, and it's often a major concern for patients who need to continue working and supporting their families. While it's true that chemotherapy can be tiring, it is, and it may require some adjustments to your daily routine, it doesn't automatically mean you have to put your life on hold. Many patients are able to continue working either full-time or with a modified schedule throughout their entire treatment course. With some modifications to their diet, to their routine, and to their work schedule, they can lead relatively normal lives. The key is to listen to your body, communicate with your care team, communicate with your employer, and make adjustments as needed. It's about finding that balance that allows you to prioritize your health while still maintaining a sense of normalcy and purpose in your daily life. Myth number 4. Everyone gets the same type and dosage of chemotherapy. This myth suggests a one-size-fits-all approach to chemotherapy, which couldn't be further from the truth. In reality, chemotherapy is a highly personalized treatment. There isn't a single drug or dosage that works for everyone. Nobody's cancer is the same as anybody else's. Makes sense. Instead, your medical team carefully tailors the treatment to your specific situation. This personalization takes into account several critical factors: the specific type of cancer you have, its stage, your overall health, biomarkers on the samples. For example, a patient with early-stage breast cancer will receive a very different chemotherapy regimen than someone with advanced lung cancer, or that breast cancer would be given something different if it was triple negative. Even within the same type of cancer, variations in the genetic markers or a patient's general health can lead to completely different drug choices and dosages. This individualized approach ensures that you receive the most effective and the safest treatment possible for your unique diagnosis. Myth number 5. Chemotherapy is only for late-stage or terminal cancer. This is a common misconception that can lead to a misunderstanding of chemotherapy's very broad utility. Many people believe that chemotherapy is a last resort, only used when cancer is reached an advanced or terminal stage. That couldn't be further from the truth. Yeah. Complete rubbish. Complete rubbish. Chemotherapy is a versatile treatment that can be used at various stages of cancer, often with a curative intent. For instance, it can be used, again, as what we call a neoadjuvant therapy, which means it's administered before surgery. In this scenario, the chemotherapy aims to shrink the size of the tumor, making it smaller and easier to remove. That can be really helpful if the tumor is right up against a critical organ like the heart. It can make an inoperable tumor operable. Conversely, chemotherapy can also be used as an adjuvant therapy administered after surgery. Here, its purpose is to eliminate any remaining cancer cells that might have been left behind after the surgical removal of the primary tumor. These microscopic cells, if left untreated, could potentially lead to a recurrence. You don't want your cancer to recur. You want it eliminated. One of chemotherapy's most significant benefits is its ability to eliminate these potential metastases. These are tiny clusters of cancer cells that may have spread from the original tumor. If you can't find them, you can't eliminate them. They're too small to be detected. So you don't have a direct intervention. You have to use something like chemotherapy or targeted therapy to get rid of these undetectable metastases. Because of this, chemotherapy is one of the best ways to prevent your cancer from coming back and continuing to spread throughout your body. So chemotherapy is not just for late-stage cancer. It's a critical tool used across the cancer journey to improve outcomes. Its actual best use is in early-stage cancers to prevent recurrence. Myth number 6. There's nothing I can do to have my chemotherapy experience be better. Now, this myth can leave patients feeling powerless, but it's simply not true. While chemotherapy is a powerful treatment, there are indeed things you can do to optimize your experience and potentially reduce side effects. So, chemotherapy drugs often have what we call a small therapeutic index. That means that the effective dose, the dose that you need to have to do the job, is not very far from a toxic dose. This makes it incredibly important to avoid anything that might alter how your body responds to these medications. Many common foods, other drugs, vitamins, and even seemingly harmless supplements can interact with chemotherapy drugs. Some can interfere with the way that your body breaks down the drugs. That can lead to higher concentrations and potentially much more severe side effects. Others might cause your cells to retain more of the drug than intended, again, increasing toxicity. Conversely, a few substances can actually block the proper activation of certain chemotherapy drugs, making them much less effective. This is why it's absolutely crucial to have a careful and thorough, very thorough review of all of your medications, all of your supplements, and even your dietary habits with your medical team. This goes way beyond the standard advice of just avoid grapefruit. There are lots of other foods that have an effect. By understanding these potential interactions for your specific chemotherapy regimen, you can work with your doctors to both improve the efficacy of your treatment and significantly reduce the unwanted side effects. You are an active participant in your treatment, and your choices can make a difference in your health journey. So, there you have it. We've covered a lot of ground today, fairly surface level I know, but a lot of ground, debunking 6 common myths about chemotherapy. We'll go into many of them in much more depth later. Some were probably what you expected, and some might have surprised you. Remember, modern chemotherapy is far more manageable and effective than outdated portrayals suggest. It's highly personalized to your unique situation. It can often be administered on an outpatient basis, and many patients maintain a relatively normal life during treatment. Most importantly, there are proactive steps you can take to optimize your experience and reduce side effects. Beyond these videos, if you need more personalized guidance or a deeper dive into specific treatments to have your treatment be as effective as possible, I offer one-on-one sessions. I'm also currently in the process of developing an exclusive video series that breaks down each and every drug, every treatment in detail, along with ways to optimize them. You can find that information on these resources on our website, which is linked below. Thanks for watching, and remember, knowledge, real information, is power. The more you understand, the more confidently you can navigate cancer with clarity. After watching this video, for those who are comfortable sharing, it's a personal thing, what's one piece of advice you wish you'd known or that you'd give to someone else before starting a treatment journey like chemotherapy? Your experience could help someone else feel less alone. Let us know in the comments. Be sure to like, share, and subscribe for more science-based cancer insights. I'll see you in the next video. I'm looking forward to getting into much more detail. Thank you.